To mask or not to mask? It used to be a health question, but now it's getting political. The issue has sparked heated debates on social media, and some have even claimed that these masks are dangerous. KCTV5's Betsy Webster is separating fact from fiction.
At this Brookside Price Chopper, the vast majority of people were wearing masks.
I think it's better to be safe than sorry.
And those who weren't didn't want to talk about it.
It makes me sad that wearing a mask has become associated with fear.
I've seen the sparring on my own social media feeds. People who wear masks shaming those who don't. And people who don't saying, you know what, why don't you just mind your own business? You're freaking out over nothing. Now some of those folks have taken it a step further, claiming that masks can actually cause harm. Take this article on a right-leaning website, repeating, then recently correcting, a claim from a neurosurgeon that mask risks vary from headaches to increased airway resistance, carbon dioxide accumulation to hypoxia, which could make people pass out.
But I know that to be completely false. That how would any medical people ever work if it caused hypoxia?
But hypoxia hype has taken hold in numerous countries. So we checked with an infectious disease specialist at the KU Health System. He says the theory that masks mean a dangerous imbalance of oxygen and carbon dioxide just doesn't hold up in reality.
Whether you're wearing a cotton mask or even a surgical mask, you have the outlet on the sides of the mask.
The logical next question, then wouldn't viruses get out too? Not like you'd think, he says.
The gas molecules that you breathe in and breathe out are 10,000 times smaller than any virus.
He says, sure, masks aren't 100% effective. That's why distancing and hand washing are important.
A lot of people don't like wearing them because they feel like they get too hot and they can't breathe in them. But it's better to just deal with it temporarily than being on a ventilator, talking about not breathing.
Dr. Hawkinson says medical staff who wear tight-fitting masks for hours on end do get headaches, but they still wear them because the good outweighs a headache. He also acknowledges one exception on the oxygen flow issue, people with lung conditions like COPD.
And that is even going to be a small proportion of people with COPD or other lung-type diseases.
Of course, the key anti-mask argument, from this high-profile protest in Michigan to social media sparring, is individual freedom. But Hawkinson says the mask is less to protect you than others. And the I'm not sick argument only held until it became clear the virus can be spread without symptoms.
I think, unfortunately, in a global pandemic, you do you does not necessarily work. It's more let's do us and let's protect one another.
Betsy Webster, KCTV5 News.